So I always like to say with community health, we are a boots on the ground type of major. The only way to learn about community health is to do. And especially with assessment and evaluation, we throw around a lot of terminology, concepts, things that can be really difficult for students to grasp in this course. And so my thought process is, in order for them to learn is to do. And so a component that is really critical to this course is service learning. And so we incorporate service learning. We really embed it and bake it into this course, where the students work with an assigned community partner over the course of the semester to evaluate some aspect of a program or a project, something that community partner doesn't typically have the capacity to do, but it would be nice for them to have some data to understand what's happening within their program. And so students get a chance to look at data, interpret it, and draw meaning from it, and make recommendations for these nonprofits to be able to move forward on. Both of these programs, they were really started right around COVID, and they have not been evaluated before. So this is their first evaluation point. So we've got some meaningful data in, and the nice thing about it is what this data does is it provides some solid recommendations, but it also gives us a point forward in what should we do next. So it gives us Dr. Collins and I, some chances with some of the other courses that we teach to be able to collaborate again with Just Food and maybe some other partners to understand what those next steps could be, so that Just Food's programs could be really robust and make more of an impact to those in need in our community. That's the most rewarding part of this is I believe Jessica Cooney, when she was here, it was my first year as a faculty member. This is the first time I taught this course. This is the first time I integrated these projects. And she also did a project on food insecurity, looking at food insecurity on our campus and faculty and staff perceptions of bringing a food pantry onto campus. And so whether she knew it at that point, I don't know, but she found a passion and a calling in life. And so it means the world to me. Like I said, it doesn't matter how many publications I have or what grants I bring in, but to be able to see a student pursue something that he or she is passionate about and to just flourish in it is all I can ask for in my role as a professor.
We are the food bank of Douglas County, so we distribute to a little under 30 partner agencies, but then we also operate an in-house food pantry that serves about 1,500 families a week.
I think it's going to be incredibly valuable because we have a communication with these shoppers, but not probably as much as we should, so it gives us a lot of insight into how we can grow that connection, build the program so it better suits their needs.
Yeah,
going forward.
They were helping us evaluate some of our programs that happen off-site of Just Food, so the places where we don't get as many touch points, and gives us some good ideas of how to improve in the future.
Yeah. A little bit. That everybody for deliveries was incredibly satisfied.
Yeah.
I expected more feedback for that one.
Yeah, we went into this thinking that we might really want to shake up some programs, and we found out that for the most part people are pretty satisfied, so there's some stuff to tighten up, but we're doing good work.
Good.
Yeah. It's such a full circle moment, being able to come back and receive a presentation where I was at one point on the other side of it. It proves why I love Lawrence and stayed in town and wanted to continue to work with KU and community health students and bringing the community together.
So we analyze the the home delivery service for Just Food. They put together boxes every week and then deliver them to participants at their homes, whoever's homebound, lack of transportation, stuff like that.
And we really wanted to focus on evaluating the program's efficiency and the user satisfaction of the program. So when we created the survey, we really wanted to hit on those points as we were going through and analyzing.
Overall, people were really satisfied with what's going on at Just Food and this program. There was a little tweak, maybe send out more fruits or veggies or stuff like that, but overall, people are really happy.
Yeah, I would say similar. Also, the whole application process and the delivery times themselves, people thought the whole program was convenient and easy to use. So that was great to hear.
I thought it was really cool just to get real world experience. You hear about it a lot, and we're writing a paper about something or like whatever, but I think it was cool to like see it in real time and people's real experiences and just like learning from that.
Yeah, I agree. And seeing what people want to say back to a program, and it makes me think like when I fill out a survey, like what can I give to them kind of. So I thought that was really cool, and to get out into the community and actually hear what people have to say was really cool.
So basically we did a program evaluation within a program of Just Food. We specifically did the Cruising Cupboard, which is a mobile food pantry that goes to about 7 stops all across Douglas County and just tries to serve the people in need there.
We were looking for whether or not Just Food was communicating their services accurately enough and adequately. We were also looking to see if the frequency of the location stops that they have were good enough and if users were satisfied with all that.
I think a major thing we learned is how important the services are. I know there was kind of a drop in a couple of the locations, and so we were really tasked with figuring out what was happening there. And with the overwhelming response being very satisfied with the services the Cruising Cupboard was provided, we really got to learn how important it was and how needed it is in our community.
So a big portion of community health is kind of in its name. It's assisting the community. And I really enjoyed actually doing a program within Lawrence, not only because I'm not from here, I love the town itself. So being able to help people in the town that I'm currently living in really makes my work feel like it paid off. And I think it's good advice for myself to like take into the future.
Yeah, I would say similar to her, it was just really nice to have a class that gave us like real world experience as opposed to just like testing and doing the regular assignments and stuff.
Not only learning what we'll be doing in our future careers, but being able to actually do it, I think is an experience that we all need to take and are very fortunate to be able to take in our program. And it gives us more confidence to go forward.